Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the series of lectures of core clinical neurology. There are going to be about 52 episodes of core clinical neurology, and if one listens to all these 52 episodes of core clinical neurology, one would have acquired a good knowledge of clinical neurology. Right now we are on part 27, the core clinical neurology, the corticospinal tract. So in this episode we are going to discuss the corticospinal tract. The corticospinal tract is important in controlling discrete, isolated motor responses, especially fine voluntary movements of the individual digits. The supplementary motor area M2 seems to be involved particularly in planning and integrating bilateral body movements. The axons of the corticobulbar and corticospinal tracts terminate on the motor nuclei of the cranial nerves and the anterior horn cells of the spinal cord. The extremity weakness of the corticospinal tract lesions reflects the preferential corticospinal tract innervations of certain muscle groups and has a characteristic pattern, the pyramidal or corticospinal distribution. So in the upper extremities, weakness preferentially involves the wrist, fingers, elbow extensors, supinators and external rotators and abductors of the shoulder. Easy to remember is by the mnemonic DATES, DATES, deltoid, that is an abductor, DA, T is for triceps, E is for extensors of the wrist, finger and elbow extensors and external rotators, and S is for supinator. So DATES is the mnemonic wherein we can talk about all the weakness of corticospinal tract involved muscles of the upper limb. Whereas in the lower limbs, weakness is most marked in the foot and dorsiflexors, knee flexors and flexors and the internal rotators of the hip. This can be remembered by the mnemonic HD. H is for hamstrings, H, D is for dorsiflexors. So hamstrings, hip flexors and dorsiflexors are involved, HD. Spasticity probably results from the imbalance of the facilitatory and inhibitory centers in the midbrain and brainstem reticular formations, as well as altered balance between alpha and gamma motor systems in the spinal cord. Examination soon after corticospinal tract lesion typically reveals flaccid paralysis and areflexia on the opposite side of the body known as cerebral shock, but is soon followed by spasticity and hyperreflexia. Spinal shock. When the corticospinal pathways are affected by a spinal cord lesion of sudden onset, especially bilateral, there may also be a period of flaccidity and areflexia accompanying the paralysis below the level of the lesion. This is the period of spinal shock, which sooner or later gives away in most instances to the corticospinal syndromes. So these are the wonderful concepts of the corticospinal tract. The other important concepts of clinical neurology, I put it in a book called Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas, published by White Army. This book contains all the essential elements of clinical neurology and will be very useful for students appearing for clinical neurology exams. If interested, this book could be purchased. The other book I have written is Focused Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. This book contains all the essential elements of theoretical neurology in a question and answer format, and this book will be very useful for students appearing for Viva OC or orals. This book is available online from all leading booksellers including Amazon, so if interested, this book could be purchased online. If you have liked this episode, please like and subscribe to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. Dr. Sreenivas Medical Concepts is India's leading neurology education YouTube channel. Thank you. Bye.